Hello everyone, my name is Dr. Sivanvesh Arsavalli, Consultant, Head of Critical Care Medicine and Emergency Medicine, James Hospital, Ragolu, Srikakulam. A 21 years old gentleman, ill comorbidities, presented with chief complaints of headache since 2 days, and during his working hours, he has sudden loss of consciousness, and on arrival to James Emergency, his GCS was 3/15 and bilateral pupils are dilated. Then we done non-contrast CT brain. It was suggestive of subarachnoid hemorrhage and associated with intraventricular hemorrhage. Now today I am going to talk about the process of declaration of the brain death. Now we are moving into the main part of the examination. It has 4 steps. First one prerequisites, second one examination of the patient, third one apnea test, fourth one ancillary test in case apnea test fails.
So what are the different outcomes of coma, sir?
On patient with coma, there are 3 possible outcomes. The first one, patient recovers from coma completely, then he will go to home. Second one, vegetative state. This one, patient will take his own breath spontaneously, but he is minimally conscious state. Then third one is brain death state. Now we are going to discuss about the preparation of the patient for the upcoming test. Before going to do examination of the patient, first of all, we should rule out the patient do not take any muscle relaxant, sedation or any toxins from the last 24 hours. Next, patient temperature should be around 37.5 degrees centigrade. Next, patient sodium should be around 120 to 160 milliequivalent range. Then patient saturation 98 to 99% and systolic blood pressure more than 100 mm of mercury. Now I am going to discuss about the preparation of the patient for the upcoming test. First of all, we will increase the FiO2 to 100% for pre-oxygenation for the 10 minutes to maintain the saturation of 98 to 99%. Then we will disconnect the patient from the ventilator. During that period, we will observe any spontaneous breaths for 8 minutes. Next, we will send the PCO2 level. If PCO2 level more than 60 mm of mercury or from the baseline PCO2 more than 20 mm of mercury, the test should be positive. Then during this apnea period, we will observe for any abnormal heart rhythm. If that is happen, we will abort the test.
Sir, why should we do this test for 8 minutes, not for 6 or 4 minutes?
As per current literature, during apnea period, every 1 minute there is a 3 mm of mercury of increase of carbon dioxide. Then at the end of 8 minutes, there is total of 20 mm of mercury of carbon dioxide will increase. So currently all countries will take it as this 8 minutes as a standard time. Now we are going to discuss clinical examination of the patient. First of all, we should check the central painful stimuli and observe the any patient has motor response in the upper limbs or lower limbs. Here we observe no motor response to central painful stimuli. Then we can also give central painful stimuli at the trapezius side, here or here nail bed. We can give very high pressure at nail bed and observe for any motor response at the lower limbs or upper limb. Here also there is no motor response to central painful stimuli. Now I am going to examine the brainstem reflexes. First reflex we will examine pupillary reflex. Give me torch. I am going to examine the pupillary size, direct and indirect light reflex of both eyes. Here a response was mid dilated and not reacting to light. It will tell the second and third cranial nerves are not working. This time we are examining the oculocephalic reflex or doll's eye reflex. Before doing this test, we should rule out the cervical spine trauma. Once we ruled out, then we should turn the head left and right. Then we will observe the eyeball movements. If no eyeball movements, doll's eye reflex is absent. It will tell 3, 4, 6 cranial nerves are not functioning. Now we are going to examine the how do you do corneal reflex. Arjun, give me a cotton ball. Open the both eyelids and touch the cotton ball at the cornea sclera junction. Then observe the response, blinking of eyeball. And observe the response. There is no blinking of bilateral eyelids. That means 5th and 7th cranial nerves are not working. Now I am going to examine the cold caloric test or vestibulo-ocular reflex. Before doing this test, we should rule out tympanic membrane perforation. Then after we are injecting cold saline into the external artery canal at 4 degrees centigrade. During this test, we will observe the nystagmus at the opposite direction. Observation time is 1 minute. If there is no response, then 8th cranial nerve is not functioning. This same cold caloric test again we will do in the opposite ear. Then we will observe the nystagmus at the opposite direction. If there is no response, then opposite side 8th cranial nerve is not functioning. Now we are going to examine the gag reflex. Then we will take the tongue depressor. With that, we will depress the tongue to get the space for anchor suction catheter. Now I am stimulating the posterior pharyngeal wall. I observed here there is no gag reflex. That means 9th and 10th cranial nerves are not functioning. Now I am going to examine the how to do cough reflex. Before doing cough reflex, we should disconnect from ventilator. Then we should insert suction catheter into the endotracheal tube to stimulate the cough. Suction catheter will go up to the carina. Here there is no cough reflex. That means patient 10th cranial nerve is not functioning. Now I am going to tell the how we will do the apnea test. First of all, before doing apnea test, we should prepare the patient. We will maintain the pre-oxygenation with 100% oxygen for 5 to 10 minutes to maintain saturation of 100%. Then systolic blood pressure we should maintain more than 100 mm of mercury with vasopressor support, with or without vasopressor support. Next, we will take the ABG blood gas. Take one arterial blood gas sample. In that sample, we will maintain the PaO2 value more than 200 and PCO2 value 35 to 45 mm of mercury. Next, we will disconnect the ventilator and connect the apneic oxygenation of 4 to 6 liters of oxygen. Standby ventilator. Okay. During this apnea period, we will observe the any spontaneous breaths patient had, any abdominal breaths or thoracic breaths, even small gasp also we should observe. And during apnea period, we should monitor the vitals, what is the heart rate and the rhythm also. Patient may get any arrhythmias and saturation and blood pressure and respirations. Suppose a patient had sudden hypoxia, then we will increase the oxygen to 12 liters of oxygen. Then we will observe the saturation or any abnormal arrhythmias or patient continuously hypoxic despite of increased 12 liters of oxygen, then we should abort this apnea test. Now 8 minutes are over, we should take another ABG, then disconnect the oxygenation and connect the ventilator. And this interpretation of the apnea test, after getting second ABG, PCO2 value more than 60 mm of mercury or baseline PCO2 more than 20 mm of mercury, apnea test should be positive. Give me the ABG. I got the first ABG. In that PaO2 more than 200 and PCO2 at the normal range. Give me the second ABG post apnea test. Oh. PCO2 will be 76. Oh, apnea test is positive. Now I am going to tell the when we will do the ancillary test. Once upon any apnea test is aborted or any other cause, then we will do these ancillary tests. These are all CT 4-vessel angiography or cerebral angiography, cerebral scintigraphy, transcranial Doppler or EEG. Patient family members were informed about the apnea test and the consent was taken. Family members may be present during apnea test time if they wish to be. Brain has two parts, one is cortex, another one is brainstem. Again, cortex has four parts: frontal part, temporoparietal part and occipital part. Occipital part it controls the vision, temporoparietal part it controls the entertainment, love and anger, and frontal part it controls the behavior, talk and mathematics. Then brainstem it will controls the cardiorespiratory control. If any patient has brainstem death, it will lose the cardiorespiratory control. Now I am going to tell the cold ischemia period for different organs. This importance for all these organs within this stipulated time should be transplanted. For lungs within 6 hours, for heart within 4 hours, for liver within 12 hours, for intestine within 12 hours, for pancreas within 18 hours, for kidney within 24 hours. If these organs are not transplanted within this stipulated time period, they go waste. Now we conclude patient declared as brain death after we are performing 2 times of apnea test apart from 6 hours. Patient declared as brain death. After brain death, patient will go by 2 processes. Either if patient family wishes to be withdrawal of life support, then we will withdraw the life support, or if patient family wishes to donate organs, then we will donate the organs to at least 6 to 8 people will benefit from the organ donation process. So please donate the organs and save lives.